Dr. Pimple Popper is removing open comedones. That's what we call these, also called blackheads. This type of removal, I think, is one of the more satisfying because you literally see them pop out of the person's nose. By the way, this person has a lot of these open comedones, and you can see the tool she's using is sort of the pressure is allowing the secretions and the substances to come right out. I don't usually have and never really had open comedones like this. I had closed comedones and still sometimes get them on my nose, underneath my chin. By the way, write in the comments if you get them. We are taking a look at Dr. Pimple Popper open comedone or blackhead extractions. This one, you see, this is actually on the cheek, kind of right around here. You see those little black dots where she's taking her tool to get them out. It looks like, see how she has that little speculum. Before she sort of mashed them out, she used that little speculum to try to open up the area to allow them to come out more easily. Let's talk about the black dot at the top of the blackhead. First of all, it is not dirt. A lot of people think it is dirt. It is not, my friends. Actually, it's a mixture of secretions, etc., and it looks dark, but it is not dirt. Okay. Oh my gosh, the lip. This guy has open comedones literally on the bottom of his lip, and you know that's gotta hurt, which is why she numbed him before she started extracting them. I can only imagine how tender and painful that would be to get them removed from the border of the lip. But it's not an uncommon place to get open comedones. You may be wondering what causes blackheads. Like, why would people get them? And there's a number of factors that can do it. In no particular order. Increase in the amount of sebum, like an oily material that is excreted. Okay, if you have increased sebum production, that may contribute. Also, things like abnormal formations of keratin, which is a type of protein that we find in other sort of things in our body, okay? Increase in hormone levels, right? We know that certain times in life our hormones sometimes are going wild and can increase the risk or sort of the presence of acne, the likelihood of it rather. And then there's also a bacteria that on the skin that can cause acne. And so if you have more of that bacteria, that could lead to it as well. Those are just some risk factors for blackheads and potentially other forms of acne as well. All right, so this one is an open comedone, and literally it looks open, right? It looks like it's open at the top with that dark area. You can see I zoomed in here. This is kind of what it looked like. Almost looks like a crater, right? This one I believe was on the back. I'm going to tell you about treatments for blackheads, so make sure you don't go anywhere. This one I think is really interesting. I don't remember what part of the body this was on, but she's literally like using like a fine tipped tool to almost kind of poke it out a little bit. And here she goes. She's getting it out, and it's actually very superficial. And you see the material there, right? Once she finally got this one out, it kind of was almost more surface level. And one thing I want to say about Dr. Pimple Popper is she is so awesome. She does not know me, but I feel like I know her, obviously through her show, but also I was doing interviews for a network where I got to interview her, and she was just delightful. She was awesome. And of course, she really has paved the way and been a trailblazer in sort of these pimple popping videos. And of course, she not only pops pimples, she is an expert. I mean, she's an expert clinician. So it's an honor to sort of talk about some of her videos, but also I have met her and she met me, obviously, but I don't know if she'd remember. Anyway, if you see this Dr. Pimple Popper, hello, big fan. Okay, here are some open comedones on sort of the side of the cheek here. She's using her little wand here to get those out. Let's talk a little bit about treatments because I think this is really important, okay? There are different types of acne lesions. Again, I said that these are open comedones, these are blackheads. Some medications that can really work well. There's one over the counter called Differin Gel. It's a form of, it falls into the class of medication called retinoid. There's also Retin A, there's Tazorac as well. Those are prescription versions, but Differin is over the counter often works very, very well for blackheads. Also, there's salicylic acid that comes in the form of washes and soaps and other things, creams. Also, benzoyl peroxide works very well, and something called azelaic acid. There are other treatments that your doctor may want to employ and sort of use for you if this is you. I think it's really important to know what the treatments are. As we come back to our gentleman with the blackheads again, know that there are treatments. The other thing I would say is I know it's really, really tempting to try to remove these yourself, right? Sometimes it feels like there's nothing more satisfying than doing this, but remember, removing blackheads on your own could lead to scarring, could also lead to increased infection or spreading of the infection. It really is best to sort of do this under expert supervision, meaning have them do it, have the experts do it, okay? I know that may not be the most popular answer, but it's probably the best and the safest. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Please subscribe to my channel. Click the little bell for updates. I'm also on TikTok, Instagram, LinkedIn, WhatsApp, Threads, you name it. Make sure you follow me there. Sign up for my free health newsletter at drjencaudle.com.